Okay guys, let me explain to you the emotional learning and development. Emotional learning and development describe the way the child reacts to and understands herself in the world. It is the feelings a child has and her ability to manage those feelings. Some aspects are genetic and biological. Some are learned from the way adults treat children. Temperament and gender are two important biologically based aspects of personality that make emotional learning and development unique within each child. On entering the toddler room in the morning, Kevin sobs as though his heart is broken as his father leaves. After a moment of comforting and full of energy, he enthusiastically plays with the rocking horse, leaps up, and runs to the easel. Faron enters the room quietly, kisses her mother goodbye, and settles into the housekeeping area. Terra clings to her mother's skirt, preventing her from leaving in the morning. When her mother finally is able to leave, Terra hangs back and watches the other children play while she sucks her thumb and holds her teddy bear. These examples illustrate temperament. Yes, you got it right. The adult's action matter, but the children bring unique qualities to the situation as well. These differences are known as temperament or temperament style. Temperament is how a child relates to the world. In children, these traits tend to appear in groups called temperament types. The easy or flexible child tends to eat, sleep, and eliminate on a predictable schedule, have a pleasant mood, easily enters new experiences, has moderate emotional reaction, and is not too sensitive to sensory information. The slow to warm up or shy child tends to withdraw from new situations and adjust to them slowly. The difficult or festive child is very active, emotional expression are intense, and attention is easily distracted. These children are very sensitive to changes in light or sound. They tend to eat and sleep without regular patterns, and their moods can change frequently. Temperament makes sense to most people. We see these traits in ourselves. They can cause conflict or ease in our relationship. Some temperament traits may be more helpful than others to successful development. Intensity of reaction, sometimes called emotional reactivity or vitality. Remember, reactivity can also be harmful to the child. The more highly reactive child may have more negative reaction. Children who are more reactive, either more easily upset or shyer, may be physically unable to handle a level of stress of other children in a group care can manage. When it comes to gender, boys and girls as groups are different in emotional learning and development. These qualities are probably a result of both biology and social expectation. In the womb, genes are expressed and hormones are released. This creates differences in boys and girls' bodies and brains. In infancy, there are not a lot of major differences. As toddlers, boys are more active and have less language ability and less ability to control their reaction than girls. Sometimes adults treat boys and girls differently. Parents and other adults may not want boys to express feelings because of cultural expectation or because they are already more emotional and active. Adults talk more to girls about feelings and girls use more words about feelings. Adults may also prompt girls to stay within gender roles of being comforting, caring, and having close friendship. This may encourage girls to be more expressive about happy feelings and keep feelings of shame, guilt, sadness, fear, and anxiety to themselves. Boys, in turn, may be encouraged to show anger and contempt. The next one is influences of attachment to gender. Attachment is one of the most important aspects of emotional development. In the first 3 years, Attachment is the child's sense of safety with an adult. Children with secure attachments have sensitive adults who can comfort them and help them explore. Children with insecure attachments may be fearful or dismissive. Two of the important processes become very much a part of the child's mind. These two internal processes are regulation and forming an identity. Regulation is part of every area of development. For many years, emotional regulation was the main area we talked about. It is the young child's ability to manage her reaction to her feelings. This includes being able to soothe herself to sleep, to stop crying, and be calm and alert much of the time. Regulation is also part of the child's ability to pay attention to the world. A good way to understand regulation is to look at how the body maintains control of different systems. The relationship between the body system regarding regulation is well illustrated by the image of the hierarchy of human behavioral system. In regulation and relationship, moments of distress may give parents opportunities to experience and understand the child's emotional cues. When it comes to identity development, an identity or sense of self is the feeling or knowledge that I was here before this. I am here in this moment and I will be here in another moment. A classic study of self-recognition or self-awareness. An adult puts a mark on a toddler's nose or forehead without the child noticing. Then the child is placed in front of a mirror. Under 18 months, most children just look in the mirror. After 18 months, most children seem to recognize that the image in the mirror is them, and they touch the mark on their own bodies. For decades, this was interpreted to mean that the 18 months, children are developing a sense of self. Young children with autism may not display many emotions. They may not try to share joy or excitement with others. In fact, the areas of the brain that are active in feeling emotions are less active in children and adults with autism. It is important to remember that emotional development must always be understood within the context of relationship. Adults are expected to provide safety, to see and respond accurately to communication cues, and to be sensitive and responsive. Now, I will pass this poem to someone na magpapaliwanag sa atin ng attachment theory at emotional learning para sa mga bata.
Hi guys, it's me, and I will explain the learning through child and adult relationship. Most emotional learning and development happens with adults in the first 3 years of life. The 3 areas in this section needs adult to develop. They are the attachment relationship, a sense of identity, and emotions within cultural context.
Liza is playing on a blanket when the infant and toddler teacher Tinaka walks past. Liza feels pleasure at seeing Tinaka and smiles at her. To Liza, Tinaka's smile looks somehow similar to the way her own smile feels and assures her about the accuracy of her emotional response to this experience. Tinaka adds language to the experience by saying, "Liza, are you happy to see me? I'm so happy to see you today," as she picks her up and snuggles her. Liza's sense of self in this moment is of a well-loved, easily understood, and welcomed human being. What do you think Liza and Tinaka's actions shows? They show what attachment relationship is. You got it right.
Let me introduce to you the people that are important in attachment theory.
First one is John Bowlby. He introduced the concept of attachment. For him, children use his system to explore and understand the world. But the child also seeks for survival. Therefore, the child will stay to the adult that gives him the sense of security. The second one is Amy Ainsworth. She is a student of John Bowlby and she further developed the theory. She observed infants and mothers at home wherein she came up with 3 patterns of attachment based on how the child reacts, such as securely attached children, anxious ambivalent attachment, anxious avoidant attachments. This video is the Strange Situation Experiment by Amy Ainsworth. The behavior of the infant upon reunion with his mother most clearly illustrates the attachment category of the child. Securely attached children run to their mothers and allow themselves to be comforted. Children with anxious ambivalent attachment run to their mothers but resist being comforted. Children with anxious avoidant attachment will appear to ignore the mother's return while backing up to get close to his mother. If you have infants and toddlers at home, what do you think is the pattern of attachment he or she possesses?
Children may have many close adults to them during the infancy or the toddler years. A mother, a father, aunts, uncles, or grandparents may live close to them or even together. Each adult will have their own ways of being with the child. Young infants around the world use similar facial expressions for fear, happiness, sadness, surprise, anger, disgust, and pain. Even as they begin to use language, their communication is filled with emotions. So now let's talk about the progression of emotional expressions on infants. On their first month, they learn through interaction. They begin to respond to others with big, genuine social smiles and to anticipate how their favorite adults will behave. They will coo and smile to the toys that respond contingently with their actions. On the 4th to 7th month, this is the first major shift in babies' emotions. Infants begin to demonstrate that they are falling in love. They will brighten, smile, and reach for the beloved adult when they see her. On the 9th to 12 months, this is the second major shift in babies' emotions. They discover that others can know their own thoughts and feelings. They begin to use emotional tone of others as a way of interpreting the meaning of events in the environment, and this is called the social referencing. The importance of it is that it allows the infant to use a trusted adult to judge whether a stranger or a new experience is safe. The 18th to 20th month, this is the third shift in baby's emotion. As symbolic thinking becomes established, children are able to use language to organize their thinking. They remember past events and form ideas of repeated events that help them anticipate what future events might be like. And now let's talk about the toxic stress. The first one is the positive stress. These are just the common life events such as immunization and the frustration. A caring and responsive adult helps the child to cope up with the stressors. The second one is the tolerable stress. It is caused by an event of greater magnitude such as parental divorce or natural disaster. The stress is tolerable because an adult buffers the experience for the child. Lastly, the toxic stress response. It comes from frequent, strong, and prolonged activation of stress response without the benefit of a buffering adult. The cause of toxic stress includes abuse, neglect, exposure to violence, parental substance abuse, and maternal depression. Toxic stress causes the brain to be hypervigilant in searching out of danger and restricts the ability to learn. The impacts of maternal depression. The baby blues is a friendly name for a very serious problem. And now let me show you some statistics about the levels of maternal depression or postpartum depression.
The baby blues affects a majority of 50% to 80% of new mothers. This may include a few days of mild feelings of sadness, fatigue, tearfulness, and feeling overwhelmed. Most women begin to feel better before long. About 19% of new mothers have a more moderate to severe depression. This will interfere with the woman's life and her ability to bond with her baby. The mother has a low mood, sleep and appetite changes, and lack of pleasure in daily life, poor concentration, fatigue, and irritability, feelings of worthlessness, despair, and thoughts about harming herself or her child. A very small number of women experience postpartum psychosis, delusions, agitation, paranoia, and thoughts about suicide or infanticide.
Maternal depression has negative effects even on newborns. They may have been exposed to some chemical imbalance in the mother's body. Depressed mothers may seem to responding one of two styles. They withdraw or they become very intrusive. Each of these styles has poor effects on infants' ability to regulate, to interact, and to be responsive. The good thing is, maternal depression is generally treatable through medicine and therapy. When mothers were treated with antidepressants and cognitive therapy, many had remissions from being depressed. Home visiting programs may have been identified as particularly effective for helping depressed mothers. Let me show you some programs that can enhance emotional and learning development of a child.
A program for supporting social and emotional development lists 6 important ways a parent or infant and toddler teacher can promote mental wellness.
1. Be engaged and engaging. 2. Be sensitive. 3. Be consistent. 4. Be responsive. 5. Be enjoyable to be with. And lastly, be the baby's voice. And I will pass this phone to someone na magpapaliwanag sa atin ng iba't ibang responsive programs for infants and toddlers.
Maraming salamat, Jamailah. So, ako nga pala si Ate Tin at pag-usapan natin ang process variable of quality of infant and toddlers. Ano nga ba ito? Ito ay pag-uobserba ng bawat galaw o experiences ng mga bata upang malaman natin as an adults ang kalidad ng kanilang pag-iisip, kung paano sila maka-interact sa mga tao tulad ng kanilang caregiver, kalaro at guro. Una nating pag-usapan ang responsive teaching. Ito ay ang process of understanding ng experiences ng mga bata and knowing how to respond appropriately. Dr. Jonah Lally wrote 7 gifts that good infant and toddler care and learning programs offer. At ang mga gifts na iyon ay ang nurturance, support, security, and predictability. At ang mga ito ay makakatulong sa bata na maramdaman nila na sila ay mamahalin at maaalagaan. Ang mga nabanggit na gifts o regalo ay ang clear description ng responsive teaching. Ang sumunod ay ang cultural and linguistic continuity. Aware tayo na ang mga infants and toddlers ay nagiging familiar sa mga tunog at boses ng kanilang pamilya. Kaya kahit sa murang edad ay kabisado na nila ang tunog at boses ng bawat isa, lalo na ang kanilang ina. Kaya kung ano ang salita sa bahay ay yun din ang salitang nadadala nila sa paaralan. Pero dahil nga mayroon tayong iba't ibang kultura at lengguwahe, maaaring makasalamuha tayo ng mga taong iiba sa atin. At bilang guro, tungkulin natin na ipaintindi sa ating mga estudyante ang ating pagkakaiba at ang ating pagkakapantay-pantay. Pangatlo naman ay ang meeting the needs of the individual within the context of the group. Ang mga bata ay mayroong iba't ibang temperaments. Mayroong mahaba ang pasensya, mayroong hindi. May mga batang kailangan mo munang ihele para makatulog at meron mang hindi. Kung ikaw ay teacher at ang hawak mo ay preschool, ito ay masyadong challenging para sa iyo. Ano pang hinihintay mo? Mag-shift ka na! Char. Mayroong iba't ibang pangangailangan ng mga bata. Kailangan silang obserbahan lahat. Pero hindi lahat ng bata ay nangangailangan lagi ng tulong ng kanilang guro. Mayroong mga bata na sabihin na natin kaya na nila ang sarili nila. Ikaw bilang guro, tungkulin mong malaman kung ano at sino sa estudyante mo iyon. Last will be the physical environment. Ito ay pagpapanatiling malinis at ligtas sa mundo na batang ginagalawan ng bata. Hindi lingid sa kaalaman natin na masiselan ang mga infant and toddlers. Madalas sa kanila ay sinusubuan kung anumang bagay na mahahawakan, kaya kinakailangan ng masinsinang paglilinis sa lugar at panatiling ligtas ang mga ito. Umpisa nating pag-usapan ang sanitizing and preventing the spread of disease. Napakasimple, di ba? Paglilinis para iwasan ang pagkakaroon ng sakit. We all know that infant and toddlers are vulnerable. Hindi nga nila kayang iangat yung mga ulo nila. So, kinakailangan nila ng matinding pag-aalaga. And as an adult, napaka-importanting malaman natin ang mga tamang proseso sa pag-aalaga ng bata. Tulad na lang ng tamang paghuhugas ng kamay. Alam niyo bang ang paghuhugas ng kamay ay ang primary defense against illness ng mga infant and toddlers? Napaka-basic lang, pero pag hindi natin siya nagawa ng tama, it can spread infection and worse is, it can cause diarrhea. Teachers, caregivers, and parents should wash their hands before preparing the food. Kailangan nila ng proper training in terms of hand washing. A second important area of hygiene in group care is diapering. Tama! Yung pagpapampers kumbaga. Ang pag-diaper sa bata ay hindi dapat maluwag at hindi rin dapat masikip. Yung tama lang para hindi ito mahulog. Kailangan din itong i-monitor at laging i-check kada oras. Kung may laman na ang diaper, ay kinakailangan na itong palitan agad. Tandaan, hindi dapat tayo naglalagay ng diaper malapit sa pagkain. Kadiri kaya at maaari itong maging harm sa ating babies. Paglilinis ng mga laruan, gamit at mga sapil. Nararapat na linisin ang mga bagay na nakapaligid sa bata dahil nga sila ay bata pa at wala pang isip, mahilig silang sumubo ng kung ano-anong bagay na makikita or mahahawakan nila. Madalas din silang gumapang at humiga sa sahig kaya kailangan ay nakakasiguro tayong laging malinis ang mga ito. Mayroon din tayong tinatawag na excluding children who are ill. Ito naman ay ang pansamantalang pagbubukod ng mga batang may sakit sa nakararami. Pero syempre, bago ito gawin ay kailangan mo na kumonsulta sa mga profesional na doktor. At meron ding basic guidelines from the National Health and Safety Performance Standards include specific condition for exclusion from the program. Ang sumunod ay ang administering medication. Kung ang bata ay mayroong sakit o mayroong chronic condition, the child care program may be involved in medication administration. And now, let's talk about the promoting safety and preventing injury. Bukod sa ang mga bata ay prone ng sakit, sila din ay madalas na prone ng mga aksidente. Dahil nga sila ay bago pa lamang sa pagbabalanse at di pa ganun kasanay dalhin ng sarili nila, madalas silang nadatapa at natutumba. At maaaring magkaroon ng injury. So, as a teacher, para maiwasan yun, kinakailangan mong i-monitor ang nasa paligid ng mga estudyante mo. Kung mayroon bang pwedeng matumba o mahulog na gamit, kung ang mga saksakan ba ay may mga cover, o kung may mga matatalimbang bagay na maaaring maabot ng mga bata. Responsibilidad mong obserbahan yon at nakakasigurado ka dapat na ang mga laruan nila ay non-toxic toys at ang mga bagay na may toxic substances tulad ng mga small batteries o ibang art material ay agad mo nang itago sa lalagyanan na hindi nila nakikita o maaabot. Ang last na pag-uusapan na natin ay ang adopting policies that promote and protect health. The two additional areas are important to emphasize in a discussion of infant and toddler care and learning programs. The safe sleep position and the child abuse reporting. Pero bago ang lahat, may itatanong muna ako. Ano sa tingin nyo ang tamang paghiga ng bata pag natutulog? A. Nakadapa. B. Nakaupo. C. Nakatagilid. Ang tamang sagot ay ang wala sa nabanggit. Dahil ang recommend na tamang paghiga ng American Academy of Pediatrics or AAP Task Force ay ang pagtulog ng back to sleep. Hindi yung balik sa pagtulog literal na back as in likod. Infant be placed to sleep supine or on their backs to reduce the risk of SIDS. So, ano nga ba ang SIDS? Ang SIDS or SID ay ang Sudden Infant Death Syndrome. Yung bigla-bigla na lang namamatay ang bata sa pagtulog, and back to sleep program reduce the SIDS rate up to 53%. Dahil tapos na tayo sa safe sleep position, susunod naman ay ang child abuse and prevention. Alam kong may idea na kayo dito, pero dagdagan pa natin. Ang mga batang abused at neglected ay sensitive. Meron silang trust issue kahit kanino at meron itong iba't ibang klase. Tulad ng non-accidental injury or injury na sinadya katulad ng pambubog sa bata, neglect, sexual molestation, if you know what I mean guys, yung pagmumolest siya, and the emotional abuse. Ito yung pagsasabi ng hindi magagandang salita sa bata o paggawa ng mga bagay na pwedeng maging trauma sa bata. We have different indicators of abuse or neglect. Kung ang bata ay mayroong mga pasa, pilay, paso at mga gasgas or sugat, maaari natin silang tanungin kasi mamaya baka sila ay biktima na ng physical abuse. Kung ang bata naman ay hindi na nagre-react sa unpleasant statement or action and pabago-bago ng mood, maaaring ang batang yon ay biktima ng emotional abuse. Kung mapapansin naman natin ang bata na nahihirapang umupo, nahihirapang umihi or nagdudugo yung private part, maaring ang batang ito ay biktima ng sexual abuse. At kung yung bata naman ay dressed inadequately for the weather, for example, maulan, pero yung bata pumapasok siya ng walang jacket or walang payong and meron poor hygiene, and yung batang palaging gutom na parang sabik na sabik sa pagkain at hindi nag-gain ng weight, posibleng ang bata na yun ay physical and emotional neglect. Medyo nakakalungkot lang itong pag-usapan kasi may mga tao pa rin nagdadalawang isip na i-report yung mga ganitong issue or kaso. Siguro natatakot lang silang madamay. Pero reporting suspected child abuse is not easy. Napakahirap niya pero hindi mo ito choice. Required mo itong gawin for the sake of the children. And hindi mo naman kinakailangan ng proof pag nag-report ka ng child abuse. Once na may mapansin kang kakaiba sa bata, right away, pwede mo siyang isumbong or i-report sa mga kinauukulan. And we, as an adult and future educator, we have to use our voice to protect abused and neglected children. That's all. So, ayun na nga, napag-usapan na natin lahat ang dapat pag-usapan. And now, I'm gonna pass this phone to someone who will discuss infant and toddlers with disability in child care. Bye-bye!
Hi guys, I am your future educator, Teacher Cristina, and I will discuss to you the infants and toddlers with disabilities in child care. Genetic syndrome ay nangyayari kapag ang gene ay nagkaroon ng damage sa cell division o kapag ang sets of genes ng nanay at tatay ng bata ay may dalang defective information that prevents the gene from expressing itself. Chromosomal abnormalities ay nangyayari kapag sobra o kulang ang chromosome. Ang isang tao ay mayroong 23 pairs of chromosomes or total of 46 chromosomes. Kaya kapag sumobra o bumaba ito sa bilang ng 46, matatawag na natin itong chromosomal abnormality. O may mga times naman na kumpleto ang bilang ng chromosome, ngunit hindi naman kumpleto o may kulang na parte ang isang chromosome o naka-attach ito sa ibang chromosome. Genetic syndrome and chromosomal abnormalities ay madalas makita during prenatal, at birth, or pagkatapos ipanganak ang isang sanggol. Isang halimbawa ng disorder na pwedeng makuha ng isang sanggol kapag siya ay mayroong higit sa 46 na chromosome ay tinatawag na Down syndrome o kilala din sa tawag na trisomy 21. Nangyayari ito kapag ang pang 21 na chromosome ay nagkakaroon ng extra chromosome. May 5 responsive interaction na pwede natin gawin upang matulungan ang mga infant o toddler na nakararanas ng Down syndrome upang mapanatili ang kanilang focus. First, we have contingency. This is to respond immediately to their lethal behaviors. Second is the reciprocity, or to take one turn and wait. Third is affect. Always interact for fun. Fourth is the match. Encourage the child to do what they can do. And the last responsive interaction is called non-directive, or following the child's lead. Disorder na pumapatungkol sa komplikasyon sa chromosome ay tinatawag na Fragile X syndrome. It is caused by a partially broken area on the X chromosome. Children with Fragile X syndrome are likely to have mild to severe intellectual disabilities, although they may also have normal intelligence. They may have a large head with noticeable large forehead, nose, jaws, and ears. To support children with Fragile X syndrome, infant-toddler teacher may need to help overcome feeding difficulties and promote social interest and language motor imitation. Aside from genetic syndrome and chromosomal abnormalities, meron din tayong tinatawag na sensory impairments or hearing, visual, tactile, and processing impairments. Ito ay ang problema o kondisyon na kung saan ang isang bata ay hirap sa pagtanggap at pag-process ng information sa pamamagitan ng kanilang mga senses. It can occur prenatally or as a result of illness or injury. Ang batang nakararanas ng disorder na ito ay may hirapan o nahihirapan sa pag-manage ng mga ingay, certain textures, eating, and changes in routine. To support children with sensory impairment, teachers may change the environment adding a darkened space with light-oriented activities for infants and toddlers with visual impairments. Teachers will carefully provide tactile-rich and language-rich experiences. Teachers may learn to do exercises with tactile defensive children to help them become more comfortable with touch. They may learn and use sign language with all the children if there is a child with hearing impairment. Another disorder, or what we call metabolic disorder. It is inherited deficiencies, particular in enzymes. The enzymes are not available to break down materials such as amino acids, which then build up and cause damage to the brain. Under the metabolic disorder is what we call PKU and Tay-Sachs. It is a condition in which children cannot break down enzymes, phenylalanine, which is present in almost all foods. Without treatment, phenylalanine builds up in the bloodstream and causes brain damage and mental retardation. Tay-Sachs is also an inherited metabolic disorder caused by absence of a vital enzyme called hexosaminidase A or HEX-A. To support the children with this kind of disorders, the program staff must carefully consider how will they provide emotional support to the teachers, parents, the child, and the child's peers. Proceed now to the next disorder, which called the central nervous system disorders. Ang utak at the spinal cord ng isang bata ay maaaring hindi mag-form ng normal sa sinapupunan ng magulang marahil dahil sa masasamang bisyo na dala ng magulang kagaya ng pag-inom ng alak, paninigarilyo, mababang nutrisyon sa katawan, at maternal infections. Isa sa mga halimbawa ng sakit na under ng central nervous system disorder ay ang shaken baby syndrome. It is a set of symptoms found when an infant or toddler has been violently shaken. Symptoms include brain swelling and bleeding in the brain and the retinas of the eyes. It can result in cognitive and motor damage and often results in death. Kung ang isang bata man ay mag-survive sa sakit na ito, maaari pa din siyang mahirapan at maranasan ng mga sumusunod na symptoms kagaya ng lethargy, pagsusuka, hirap sa pagsubo, pagmuya, pagngiti, hirap na pag-focus visually, at hirap sa pagkontrol o pag-angat ng kanyang ulo. For children with this kind of disorder, the teacher may be the one to recognize the symptoms of this head trauma. Every program must have a plan in place for how to report suspected child abuse. I will now pass this phone to the person who will discuss further about the infants and toddlers with disabilities in child care.
Ang next naman natin ay ang exposure to toxic substances. These toxins the mother actively inhales or inhales, such as tobacco, illegal drugs, and alcohol as well. As toxic, when the mother passively exposed, such as cleaning solvent, leads, pollutants, and pesticides, are all able to crush the placenta and harm the developing the nervous system of the fetus. Ang huli naman natin talakayin ay ang chronic illness. Ito ay may tatlong example, which is asthma, allergies, and hemophilia. Ang asthma ay isang respiratory disorder nagkukos ng pag-uubo, nahihirapan ng paghinga. Teachers sometimes administer medication for asthma with a machine na tinatawag natin nebulizer.
7 million children in the United States have asthma. Asthma is caused by inflammation in the airways inside the lungs, also known as the bronchi and bronchioles. Quite often, airborne allergens like dust mites, pollen, mold, and animal dander will cause inflammation. This causes the muscles around the airways to react by tightening, thereby constricting the airway. Additionally, airway walls begin to swell and cells begin to produce more mucus than usual, which further restricts airflow in the lungs. You'll feel a tightening of the chest, shortness of breath, and wheezing. To combat these symptoms, quick relief medication is often inhaled directly into the lungs, which causes the muscles to relax and opens the airways for oxygen to pass. Quick relief medications are often only a short-term solution. Your doctor can work with you to develop a long-term asthma control plan.
Ang another example naman natin ng chronic illness ay ang allergies. It is referred to the sensitivity of normally harmless substances. Allergies reaction may include rashes, irritability, vomiting, swelling, difficulty in breathing, or even shocks.
An allergy is an overreaction of the immune system to a normally harmless substance called an allergen. Common allergens include pollen, animal dander, down feathers, mites, chemicals, and a variety of foods. On first exposure, the inhaled allergen enters the mucous membrane lining the nasal passages, where it is taken up by the antigen-presenting cell, which presents it to the T cells. These T cells activate the B cells to release substances called IgE antibodies against the allergen. These IgE antibodies sit on the surface of the mast cells. The mast cells have granules containing chemical mediators like histamine and prostaglandins, etc. On exposure, the allergen binds to the IgE antibodies present on the mast cells, cross-linking them. This results in the release of histamine, prostaglandins, and other mediators into the surrounding tissue. These mediators cause dilation of the surrounding blood vessels and increase their permeability. This results in the nasal stuffiness, sneezing, and mucus discharge of allergic rhinitis. Antihistamines work by blocking the action of histamines at its receptors and thus decreasing the body's reaction to the allergen.
And lastly, hemophilia is an X-linked disorder caused by a lack of proteins needed for a blood clotting. Children may have dangerous internal bleeding from falls and bumps or unable to stop bleeding from the minor cuts.
This is Ben. He's eating his breakfast with his family. For us, it's just a cut. But for Ben, such injuries can have serious consequences. His family knows that Ben suffers from an illness known as haemophilia. What is haemophilia? Haemophilia is a congenital disorder inhibiting natural blood clotting. Affected persons lack the natural clotting agent that stops the bleeding in the event of an injury. Individuals with haemophilia cannot produce enough of this clotting agent, known as coagulation factor. A complete cure of the disease is not possible, but it can be effectively treated. Treatment involves adding the missing coagulation factor to the blood. This concerns external injuries such as nosebleeds or open wounds, but also internal injuries. Haemophilia is little known because it is rather a rare disease. Only 1 in 10,000 individuals have this gene defect. Women can be carriers of the disease and pass it on to their descendants, but the disease, occurs extremely rarely in them. 3 different degrees of severity of haemophilia are recognized. In mild severity, the coagulation factor activity is 5 to 40% of a healthy human. In moderate, 1 to 5%, and severe less than 1%. Depending on the degree of severity, the coagulation factor is administered to the patient in different doses and at different intervals. With the right medical care and the appropriate medical treatment, haemophilia sufferers can therefore lead an almost normal life. However, the disease remains a constant companion, and haemophiliacs must always exercise due caution. The Swiss Haemophilia Society has been supporting the needs of sufferers for more than 50 years. It offers information and networking and represents the rights of people with blood clotting disorders. It is supported by a network consisting of medical practitioners and
supporting development. Teachers must have plans in place describing how to recognize and respond to the symptoms. These conditions are episodic and may be emergencies. Nonetheless, on a day-to-day basis, teachers should be using their well-developed skills and responsive caregiving, individualized planning, and relationship building. And that's all, guys. See you. Bye.